naloxone, Suboxone, and methadone, and she's interested in what we're doing here. She's coming to the open house here tonight, so it's heading in that way. One of the problems is, and this is unfortunate, but this is one of the problems, is that partly because of the demographic in addiction, unfortunately, has a high percentage that is destitute, and because of that, access to medical treatment is lower. Those things are changing. Access to recovery, the ATR establishment, and here we're doing that at the Guideline Market as well, with getting Medicaid access, having access to clinics like FMC that is actually this week trying to work out what's called the Screening-Free Intervention Program, which is a federal grant that can provide a primary care resource, like a primary care doc's office, the resources to screen people for addiction, and then hook them into the right treatment places that ideally everything gets paid for. Statistically, we now know that if you provide treatment for people in society as a whole, you have significantly less crime, less ER visits, less use of public medical funds, which to society as a whole is an important factor in making these decisions. So in funding programs like this, it's not just to help your fellow man, but it's also to help the whole society in that burden.
And on that note, have you seen a dramatic? I mean, the addiction community, so to say, in the last 5 to 10 years, have you seen how has that evolved from where we were back in the 90s to where we are today? I mean, is there an increase, decrease? How are things going?
From the treatment?
From the people getting in trouble with drugs, the people that you're running across, are you seeing an increase of problems with drugs?
Colorado's following a lot of national trends when it comes to prescription drug use. So the use of prescription opiates illicitly has increased. And the use of actually methadone by pain doctors has increased, and that was actually featured in an article here a couple of weeks ago. Heroin is not as popular, it's still around. The numbers of people that are getting in trouble or misuse or problem use with prescription painkillers as well as benzodiazepines has increased. And it's a younger population that's emerging, and there's a lot of reasons for that are thrown out there. It's a quote legitimate problem. In other words, grandma takes the medicine all the time. It's a legal problem. In other words, well, this medicine's legal. My doctor gave it to me, so what's the big deal if I break it up and snort it, or I took more tonight because it helped me with other things? So that has been emerging nationally. Methamphetamines is tending to taper off, at least in Larimer County a bit. It doesn't mean it's not there; it's still there. Still, your number one drug problem, or your number one reported problem, ER visits, is still alcohol and alcohol-related problems. Your stimulant abuse is not as high. Opiates is definitely the most increasing number, so it's not statistically as high as alcohol and marijuana, but it's which is probably your top two. But it's increasing the most. So statistically, it's coming close, and it's exponentially going up every year. But I mean, if I could say something to what you're saying on the last side, it's an interesting piece that's going on with from the treatment side of things. There's two camps that are starting to merge, and I tend to be an optimist with this because I think why not? Instead of being a pessimist with it. And 5 minutes to do with this. Oh yeah? Yeah. What am I speaking of? Addiction treatment in the psychology circle. So your psychologists, your psyches, your PhDs, your counselors, their training has been abstinence-based. In other words, the goal of recovery is abstinence. Now, there's utility to that, there's truth to that, it is driven in that field. From the medical side, American Society of Addiction Medicine, the physicians, the PAs, the nurse practitioners, recovery has taken on, with the understanding now and the development of the understanding the neurobiology of addiction. There's all these exciting new medicines that come out everywhere from Camprol and anabuse and naltrexone to alcohol problems to methadone to morphine to opiate dependence to you name it. I mean, we could have a list, Chantix and tobacco. And what's interesting and what I think is necessary is the merging of these things. And a lot of clinics around the country they are already doing this. But what's going on is that we're starting to step back and look at how we're doing as a whole in running anywhere from 20 to 30% recovery rate for patients with OSD as far as hypertension, diabetes, and other problems. So trying to find a middle ground, we're licking a lot of old wounds, or maybe the skiing contest that might have been going on has zipped up the zippers a little bit. At least I like to think that. And I had a meeting on Tuesday with 10 certified addiction counselors who all we were saying by the end of the meeting was, how can we help these people the most? How can we give them the most tools? And with the goal of recovery being recovery and not necessarily abstinence or being on this medicine, and seeing what are the goals we're looking for people in their lives, getting their spouses and children back, getting their spouses back, getting their concomitant depression and anxiety treated. And ideally for most people, not everybody, for most people, if you can get those things in line, these people have a lot of great tools to go forward. So hopefully that's coming together and we're meeting in the middle, and just one day I think it'll be just commonplace if you go get treatment for your addiction, you see a counselor, you see a group, someone in group, and you see a medical provider. And all three of these things can be taken care of, as well as the social interventions, family support, counseling, et cetera, et cetera.
One last thing. Are there any projects that you're working on currently that you're part of, either on a national or state level, that you're excited about, like to get word out about?
Sure. Well, a couple things. ADAD is on July 17th is doing we're doing a lecture on prescription drug abuse that's for providers and also just healthcare providers in general, physicians and counselors. That's going to be done in January. We'll get more information about that. And there's something that could be emerging that's on the back burner right now, that there's a research project about studying Suboxone or buprenorphine with cognition, about actually having, and there's a psychiatrist or psychiatric provider, nurse practitioner who I talked to this week who started a research project that we might be part of that is looking at checking people's cognition before they get put on buprenorphine and then checking them a month later, and the idea or the theory is, or the hypothesis is that their cognition improves, actually. And that would break down a lot of barriers for the use of this medicine for impaired professionals such as physicians, doctors, or nurses that right now are not allowed to use methadone or Suboxone. They have to get put on naltrexone, and inevitably they don't do as well. Now they do well statistically as a whole as a group, but it's breaking down the barriers of treatment. And so we need that research, we need that data to be able to go to the board of medical examiners and things like that, to be able to talk to them and present that, and not just based on anecdotal experience. So that's good that research is going, and we're going to be part of that, hopefully.
Great. Well, thank you very much.